This is a condition where the eyes move rapidly in an uncontrollable fashion, showing rhythmic patterns which is not in our control, is known as nystagmus. It is commonly known as dancing eyes. Coming to the causes of nystagmus are myopia, some medicational drug toxicity, head injuries, and inner ear problems. Very common symptoms for nystagmus are oscillopia is nothing but a shaky image which is perceived by jumbled eye movements. It can also result in vertigo, dizziness, strabismus, decreased visual acuity, and holding the head in a tilted position. Like any other diseased condition, nystagmus can also show congenital cause as well as acquired cause. When it comes to the congenital type of nystagmus, it usually begins right after birth shortly. Mostly it is due to developmental abnormalities in structure of the eye or the visual pathway. When it begins anytime after 6 months of age, it's acquired nystagmus. It can have medical or neurological causes, which includes head injuries, inner ear problems, and brain tumors. Horizontal or pendular nystagmus, it refers to oscillations of equal velocity around a center point. It can indicate congenital loss of visual acuity or multiple sclerosis. This particular type is also known as seesaw, which is rapid and shows seesaw movement of the eyes, in which one eye appears to rise while the other appears to fail. It could be due to lesion in the optic chiasma. Rotatory nystagmus, which is also known as torsional nystagmus, refers to a rotatory movement of the globe on its visual axis. Torsional nystagmus is usually increased on lateral gazing. Physiological nystagmus occurs when we move in a circular fashion for a longer time, that is vestibular nystagmus. And it's also seen when we follow a particular object which is in motion, like a moving car or a moving bike. Optokinetic reflex is when we look at a moving object like a moving fan for a longer time with a constant stare. The most common cause of acquired pendular nystagmus include demyelinating disorders such as multiple sclerosis and the syndrome of ocular palatal tremor. Jerky nystagmus is a rhythmic eye oscillation characterized by a slow drift of the eyes in one direction that is repeatedly corrected by fast movements in the reverse direction.